Everybody, let's get this party started.
It's Wednesday. It's not a good time.
Morning. I'd like to call the King County Public Health Committee for January 17th at 9:03. Clerk, please call the roll.
Dewey.
Sorry.
Silva. I think I have Silva.
Silva is
Tarver.
here.
Oh, thank you. Tarver
Tarver's here.
and Williams. Young,
Young here.
Sanchez,
Sanchez present.
Strathman.
Strathman here. Okay, and we have a remote request from Dr. Silva and from Mr. Tarver. Is that okay with everybody? Okay. Good morning and welcome to you guys. Okay. I'd like to ask for approval of the minutes from November 20th, 2023.
So moved.
Okay, a second.
Young.
Silva seconds.
Okay, thank you, Mr. Young this time. All in agreement, please say aye.
Aye.
Okay, we gotta wake up this morning, everybody. So we have some public comments this morning. I only have, what was that?
It's just Zoom.
Oh, okay. All right, I have Jean Meyer, who's speaking on agenda. Jean, are you here? Oh, there you are. Good morning. I don't know if your microphone is on, Jean.
Is that it?
There you go. There you go. Thank you.
Better.
Okay. Jean Meyer, Christian, lover of these United States and our Constitution, master's prepared registered nurse. I want to start by thanking you all for the fact that Kane County had no vaccine passport. I didn't even really think about that, and you need a warm round of applause for that. What Cook County and DuPage County did is not compatible with our form of government and is a very real danger to we, the people, who are the government along with our Constitution. I speak in opposition to Agenda Item 8D and E, which expands the size and scope of this health department. Several months ago, one of you in this committee said that our health department had significantly less staff than other counties. I believe it was per population, and I see that as a good thing. I want to speak to that, and now these agenda items allow for that. What direction is best long-term for the people of this nation and this county? At all levels of government, we are attempting to create a seamless web of free or reduced services from cradle to grave. 2 points in opposition to this mentality. Number one, this is socialism. The money comes from the population that works hard to have, and they resent money being taken from them. That promotes a helpless, unhappy population. We have a constitutional republic that functions by encouraging individuals. Oh boy. When I tried to make eye contact, that's what happens. It encourages people to be rugged individuals and to care for themselves and their family without government intervention. All of the grants given by the federal government, in which they recklessly print paper money, which they hold out on strings to the state and counties, is not within the federal government's realm as given by the Constitution. It matters where money comes from. Tell the federal government to cease and desist their obliterating our 10th Amendment to the U.S. Constitution, which gives us local control. I put those two words in bold, local control. We, the people at the lowest level of government, have a say. Number two, providing endless free or reduced services keeps a significant portion of our population slaves. This is not a good thing we do to them that the rest of us support. The more services you give, the more this population takes, giving them less freedom to work hard and be prosperous. A real life example is friends of ours who are now seniors and in poor health. They spent at least a good part of their life making sure they didn't work so much that they would lose their subsidies. Now they're hurting at, oh, I forgot my second page. Now they're hurting, and at times they have been living in homeless shelters, and it's not a pretty sight the way they're living. And so by making slaves of people and keeping them very low, we don't help these people. Anyway, I would ask you to vote no on both adding a visiting nurse and in making a new public health facility. We need to try to keep taxes low so that our most valuable natural resource, our young people, can have the same chance to live and work hard and be bountiful that we had. And it doesn't look very good for them now. And so for all of our young people, let's encourage them to be rugged individuals to make this country great. Thank you so much.
Thank you. And that's the only, that's.
Move that
the
closer.
financial reports are-
Is your mic on?
Is it not working? Can you hear me now?
Yes.
Here I am. Okay, financial reports are included. Do we have any questions about any of them? Okay. And good morning, Mr. Youngstead.
Good morning, everyone. All my reports are on file. I don't have much this month. If anybody has questions for me, please let me know.
Questions? We do have, you do have a busy year. You've had a busy year wrapping up, didn't you, this last year,
Yes,
when I was
uh,
looking at your reports?
Yes, it was a busy year, especially the hoarding case, which I hope to have some more information for you next month. We'll be in court today for a next step. So hopefully we'll have some more information on that as well going forward.
Okay, good. And we do have a resolution this morning?
Yes.
Okay, I'd like a motion and a second and possible passing of the resolution 24-1818, authorizing a contract for Kane County Animal Control Generator Installation Project.
Sanchez moves.
Tarver
Jurgensen.
seconds.
Okay, we, somebody answer the door, would you?
Don't. It's speaker time.
Thank you. Thank you. Okay, so it was Sanchez moves and Juby second. Okay, any discussion on this? Brett, would you like to tell us a little bit about this?
This has been a long time coming. Animal control has never had a generator at its facility, and there are animals housed at that facility 24/7. Even in the snowstorm on Friday, I had to have 3 employees come in to not only check bite reports, we had to take care of all the animals, medicate, feed, water, things like that. So we are always constantly open. We have people coming and going at all times of the night. If anybody read Facebook lately, those 5 puppies in the cardboard carrier, that was about 11 o'clock at night with the sheriff's office in West Dundee. So again, people are all times of the night, an hour, day, coming and going from that facility. So this is something to ensure that we have continual operation. This helps ensure that we have power, the ability to clean, take care of the animals, medicate. In the summer, keep them cool, in the winter, keep them warm. So this has just been something this facility has needed for a long time, and I'm just glad we can finally get this moving forward.
Okay, any questions? Any discussion? Okay, please call the roll.
Juby,
Kirby, aye.
Silva,
Silva, yes.
Tarver,
Tarver, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes,
Yeah.
passes. Okay. Okay, we look forward to hearing your report on that hoarding situation next month. So, thank you. And now over to Mr. Isaacson. Good morning.
Great. Good morning, everyone. Happy to see you all. As Mr. Roth said, what did you say? It's 2%, 200% warmer than it was? Yeah. So hope everybody's
I like that
enjoying it.
optimism.
I'm
Gotta be with this one.
Yeah.
really excited to start off today. We have special guests who are joining us today. So a theme for a lot of the work that we do at the health department is trying to make sure that we're engaging residents as much as possible to be part of the process. As part of our children's mental health system of care, really engaging and giving voice to parents is a key component of that. And I especially when we look at waiting lists. So we've used the example before, if somebody has a child who maybe has a new diagnosis for a mental health issue or something's happening that's a little bit scary, they find out that they may be on a waiting list to get services. A lot of the work that the fantastic people behind me have been doing is providing support to each other in a peer-to-peer way. So I'd like to call our children's mental health manager, Kate McCormick, up to the podium to tell a little bit about the exciting work that's been going on over the last few years and introduce some of our parents. So Kate, I'll turn it over to you.
Good morning.
Morning and welcome.
Thank you. So thank you, Michael, and thank you, Chairwoman Strathman, and all of you for inviting us. And wanted to say thank you to the whole board for the commitment you've shown to mental health care and to public health. My name is Kate McCormick, as Michael said, and I'm a bilingual licensed clinical social worker, and I'm the current manager for our children's mental health initiatives, which are housed in the Kane County System of Care at the Health Department, which is also known as our long-term children's mental health. So this was the 7-year grant we got from the Illinois Children's Healthcare Foundation, and we've been working hard on it for several years. The Kane County System of Care runs several important initiatives, which you can read more about at kanehealth.com, or we're happy to talk to me or Michael at any time. But we're here today to share with you some of the incredible work of our parent and caregiver leaders. The parent and caregiver leaders are in a group called the Parent Council, or Concilio de Padres, and in Spanish, and they have the goals of lifting parent voice through education, outreach, and advocacy, and they are parents and caregivers advocating for the health and well-being of children and youth. I would like to introduce Sarah Gonzalez as well. Sarah Gonzalez is the lead organizer from Community Organizing and Family Issues, a community organization who has been working with us to create the Parent Council. And we've been really lucky to get to work with Sarah the whole time. And she helped us recruit and form the group and still continues to help lead them today. So thank you, Sarah. Lifting parent and caregiver voice is vital because parents bring accountability and urgency, as well as real-world experiences utilizing mental health services for their children. The Parent Council is made up of 20 parent leaders, primarily from the cities of Elgin and Aurora. In December, the Parent Council received the Partner of the Year Award from Compañeros en Salud, or Partners in Health, an organization that promotes health awareness in the Latino community in the Aurora area, for their work supporting both behavioral health providers and the community by providing therapeutic support groups. Jason Andrade, Vice President of Family Counseling Services in Aurora, nominated them for the award, stating, "The parent liaisons offered health and well-being education and support to these families while they awaited a first behavioral health appointment. By working with community partners such as Family Counseling Services of Aurora, Family Service Association of Elgin, the Aurora and Gail Borden Public Libraries, the Parent Cafe team directly contributed to a system of support that did not previously exist. It is this type of intervention based on true community need and community advocacy that leads to change." I am incredibly proud of the work that our parents have done. They have blown me away over the years. This was supposed to be sort of one piece of our project, and I feel like it's really become the heart of the system of care, and they've gotten involved in supporting all the other work that we do as well, including most recently our community health assessment, making sure that we got some of our additional surveys done in the month of December. So they've really been just an incredible group. And working with them has been one of the greatest joys of my professional life, to watch them grow personally and professionally and become such excellent and knowledgeable advocates about mental health has been an incredible privilege. I am so proud to now introduce Claudia Serrano and Nelly Paredes, who will tell you more about their work. We will be utilizing interpretation, so they will speak for about a minute or a minute and a half, and then we are lucky to have Aida Palma, who is a really excellent interpreter, who will interpret what they said to English, and so we'll go back and forth that way. So thank you again, and here is Claudia Serrano.
Good morning, everyone.
Morning.
Thank you for having us. Mi nombre es Claudia Serrano y soy miembro del Concilio de Padres. Quiero decir que estoy muy agradecida con el Departamento de Salud del Condado de Kane, en especial, pues un agradecimiento a Kate por crear este espacio, esta oportunidad para los padres trabajar con los mismos padres. En mi experiencia, quiero dar testimonio de que ha sido un concilio que nos ha ayudado a desarrollarnos, a profesionalizarnos como padres para ayudar a las familias y ha sido un espacio en donde como equipo hemos creado espacios seguros para que los padres en lo que están en lista de espera puedan ser atendidos y sobre todo hemos buscado espacios de prevención en donde lleguemos a darle a las familias las herramientas necesarias antes de que se convierta en un problema de salud mental y seguimos abogando porque este tipo de programas existan.
Good morning, everyone. First, I want to say thank you to the Health Department of King County, and thank you to Kate for creating this space where parents have been able to work to support and help develop other parents. In my experience, being part of the Parent Council has been a huge opportunity for professional development and to be able to support other families in creating safe spaces, especially for families that are on waiting lists for mental health services. We've really focused our work in creating spaces of prevention so that families have the tools to be able to address situations before they become mental health crises.
Durante estos 4 años hemos sido equipadas con diferentes modelos para educarnos y compartir el aprendizaje a la comunidad en el tema de salud mental. Y uno de los modelos que hemos obtenido es el que maneja COFI, que es Organizando Comunidades y Temas Familiares. Y aquí le quiero dar las gracias especialmente a Sara, donde hemos recibido todo el apoyo de ella. Y ella es una organizadora de COFI que nos provee herramientas, dirección y organización para trabajar como personas, con nuestras familias y con nuestra comunidad, y así como aprender a trabajar en equipo para que juntas logremos cambios que impacten en el bienestar de las familias a nivel condado, especialmente atendiendo niños y jóvenes. El Concilio de Padres que estamos en Elgin y en Aurora trabaja con agencias y organizaciones locales en temas de salud mental, entre ellas las que forman parte del equipo de implementación del cuidado.
Over the last 4 years, we've been equipped with different models to educate ourselves and share the learning with different community members around the issues of mental health. One of the models that we've been training is with COFI, which stands for Community Organizing and Family Issues. And for that, I want to thank especially Sara Gonzalez, who is the organizer that supports us as a parent council. This is an organization that provides tools, direction, and organizing skills to work amongst ourselves as individuals, with our families, and in our broader community, as well as learning to work in a team to achieve changes that impact the well-being of our families at a Kane County-wide level, especially considering the needs of our young people and kids. The Parent Council in Elgin and Aurora works in these 2 communities especially, and we collaborate with agencies and organizations around issues of mental health. Among them, we form part of the implementation team in the system of care.
Como equipo encuestamos a 460 personas en Elgin y en Aurora, y el resultado de estas encuestas fue la alta necesidad de servicios de salud mental para las familias, una larga lista de espera y la falta de proveedores para estos servicios. Falta de seguro médico que cubra estos servicios tanto para adultos y que sean en español. Como padres decidimos capacitarnos para ofrecer grupos de apoyo y que fuera también de apoyo de padre a padre en la comunidad. Estamos certificadas, varias de nosotras, para ser facilitadoras de cafés para padres, grupos de apoyo con el modelo de NAMI y círculos de justicia restaurativa. Ofrecemos estos espacios física y emocionalmente seguros donde las personas hablan y se escuchan unas a otras sobre diferentes temas para ayudarles de una manera terapéutica. Actualmente estamos colaborando con Family Service Association en la Gail Borden Public Library de Elgin y en el Family Counseling Service en la Biblioteca de Santorini en Aurora, así como en la oficina de COFI en Aurora. Nos educamos, colaboramos y abogamos por el beneficio de nuestras familias y bueno, mi compañera Nelly les dirá de qué manera lo estamos haciendo.
As a team, we surveyed more than 460 people in Elgin and Aurora. The result of these community surveys was to realize the high need of mental health services for families and recognizing the large wait list that families experience, the lack of providers that sometimes are available to provide services, and often the lack of insurance that covers services for adults, especially in Spanish. As parents, we decided to get training and offer different forms of support groups, especially support groups that are from parent to parent in the community. We're certified to facilitate parent cafes, support groups through the NAMI model, and peace circles in restorative justice. We offer these specific physical and emotional protections and supports where people are able to speak and listen to one another around the different issues that would impact them and would support them in some therapeutic way. Currently, we are collaborating with Family Service Association and the Gilborden Public Library in Elgin and Family Counseling Service and the Santori Library in Aurora, as well as the Kofi office in Aurora. We educate ourselves, we collaborate, we advocate for the well-being of our families. My colleague Nelly is going to share some ways in which we do that.
Good morning. My name is Nelly Paredes y soy representante del Concilio de Padres. También hemos trabajado y planeado en foros comunitarios en Elgin y en Aurora para dar a conocer todo lo que hemos estado haciendo y buscar cómo asociarnos con representantes comunitarios para seguir haciendo cambios locales y estatales. Nos hemos reunido con administradores y miembros del Consejo Directivo de los distritos escolares U46, 129 y 131 para informar de las necesidades de las familias y darles nuestras recomendaciones. También nos hemos reunido con el Departamento de Salud y Servicios Familiares para ser parte del desarrollo del currículum de Empoderando a los Padres, líderes para un cambio de sistema, liderado por la analista de póliza Regina Kreider. Con nuestra abogacía hemos logrado que se implementen programas después de escuela en el Distrito Escolar U46, así como se ofrezcan prácticas de justicia restaurativa en el Distrito 129 en Aurora. Cada año vamos a Springfield y algunas de ustedes han ido con nosotros y compartimos testimonios personales con los legisladores. Actualmente también formamos parte del Comité de Salud Mental de Karina Villa y también hemos participado en diferentes conferencias anuales donde se nos ha asistido y se nos ha ofrecido interpretación simultánea.
Thank you, Claudia, and good morning to all. My name is Nelly Paredes, and I'm also a representative in the Parent Council. Some of the work that we've done has been planning community forums in Elgin and Aurora to let people know the work that we're doing and seek further collaborations with community leaders to continue to work on changes at a local and state level. We've met with administrators and members of the Directive Council of School District U46, 129, and 131 to inform them of the needs that we see in our families and give them our recommendations. We've also met with the Department of Children and Family Health Services to give them to help them develop the curriculum empowering parent leaders for systems change that has been spearheaded by political analyst Regina Kreider. With our advocacy, we've been able to achieve implementation of after-school programs in the school district U46 area, as well as the starting of offering restorative justice practices in school district 129 in Aurora. Each year, we also take a trip to Springfield where we share our personal testimonies with legislators. Currently, we're part of the Mental Health Committee of Senator Karina Villa, and we've been part of different conferences that happen annually, such as the Latino Caucus Foundation Public Policy Conference, the Community Behavioral Healthcare Association of Illinois Conference, and the Systems of Care Summit, at each of which we've been offered and received simultaneous interpretation in order to participate.
También hemos apoyado varios eventos comunitarios, así como proyectos con otros programas como el de Embajadores de Educación Temprana de AOK y encuestas comunitarias como Rush Copley y el Departamento de Salud, entre otros. El pasado 13 de diciembre recibimos un reconocimiento como socio del año por informar y guiar los servicios de salud mental dentro del Departamento de Salud del Condado de Kane. Desafortunadamente, los fondos a través del programa de salud mental para niños del sistema de cuidado del condado de Kane están por terminarse, pero el trabajo y la necesidad en la comunidad sigue avanzando. Estamos buscando que nos apoyen a continuar con todo el trabajo que hemos estado haciendo para seguir preparándonos para ofrecer apoyo de persona a persona y colaborar con programas de prevención en los jóvenes y en los padres. Necesitamos que el dinero se ponga donde está la necesidad de la gente. Mi experiencia personal ha sido conocer a gente maravillosa dentro de este largo rato que llevamos aquí como el concilio y ver cómo trabajan tanto para nuestra comunidad. Su trabajo es también ha motivado a que generaciones que han escuchado de todo nuestro trabajo, ellos se motivan para seguir aprendiendo y seguir trabajando. Actualmente mi hijo está en la universidad y él está muy motivado en seguir trabajando, sobre todo en salud mental. Él, su carrera va a ser neurología, pero tomar psicología es fundamental porque sabe que por medio de eso puede seguir apoyando. Entonces, su trabajo marca mucho las generaciones que vienen. Gracias por escucharnos y ofrecer este espacio. Estamos a sus órdenes para cualquier pregunta. En el futuro, claro que nos gustaría reunirnos con cada uno de ustedes. Gracias.
We've been able to support several community events and other projects and programs as ambassadors in early education through AOK and through community surveys headed by Rush Copley and the Department of Health, among others. Last December 13, we received a recognition as a Partner of the Year for being able to guide and support mental health services within Kane County Health Department. Unfortunately, the funding through the Children Mental Health System of Care grant is almost expired, and we really hope that the work and the need continues to advance, and this work continues to advance. We're seeking to continue to receive support so that we can do this work that we've been doing and continue to prepare ourselves to provide supports to people peer-to-peer, collaborate with programs in prevention to support youth and parents, and finding the money that's needed so that this funding and resources can be allocated to the needs of the people. My experience personally has been getting to know wonderful people within the Parent Council and getting to work with incredible providers that create such a great effort in our community and through their work are able to leave a mark for generations to come. I'll share that my son currently is attending university and he's been very motivated in mental health because of the work that he's seen in this community. And he's currently studying neuroscience, but also taking classes in psychology. So the work of the providers here really does create an impact for young people and for generations to come. Thank you very much for this time. And we really look forward to continuing the conversation and of course, getting to meet with each one of you on a one-on-one basis.
Thank you. Thank you so much. It just shows what great programs we have. And I just wanted to invite these wonderful people to share their enthusiasm and their experience and their great work that they're doing. So thank you. Thank you for being here this morning. Okay.
Great. And I just want to give a special thank you to Kate McCormick on our team. She's done a fantastic job working with all of these women. But also I think, and thank you for coming and speaking today. They really are making substantial change. So not only being supports for other people in the community, but they alluded to a couple of things where they're actually making policy change happen in the community in a positive way. So, and I know there's other parents who weren't able to be here in person that are with us online. So just want to thank all of them for all the great work they do. So thank you. And I'll share a few comments if we can get the presentation back up, Blair. So two things to open with. Number one, of course, we are still seeing a fair amount of hospitalizations and illness with respiratory viruses. So this is a combination of COVID and flu and RSV. Hopefully we're on a little bit of a downtick here. Fingers crossed, but again, just encouraging people to make sure they're up to date on their vaccines. And if you are sick, try to stay home if you can, so you're not spreading it around your church or your workplace or wherever else you may be. And then the second thing, I've mentioned that I have this 2-question surveys for board members because I really want to hear what your needs are in your district. I'm holding back on it because I'm trying to separate it from this whole building conversation, because the intent of that is really to hear what you want. It's not to spend time with me trying to sell programs to you. So I'm kind of waiting. So hopefully over the next couple months, I can meet with each of you individually and just kind of talk about what's going on in your district. But again, the intent of that is really for you to be telling me things and what you think we need to be doing. So stay tuned for that, please. So this is some information that we shared as part of the orientation, but as we talk about a new facility in Kane County, I thought it would be valuable just to kind of reground ourselves in a little bit of health department history and what it is that we're trying to accomplish. So of course, we are one of the youngest health departments in the state of Illinois. We were formed by resolution, which is actually quite unusual. It's unique. It's very unique. As a matter of fact, to my knowledge, we're one of 2 communities where the county board actually serves as the Board of Health. In most places, the doctors and nurses and dentists are the Board of Health. So they're voting on things for the health department. They're voting on policy and things like that. So we're unique in that you get to wear that hat to be the Board of Health here. We do have a public health advisory committee that's been set up. So they are advisory, not the traditional Board of Health, like I said, but we do have a great group who provides us with guidance there that's made up of professionals from the community. And currently we have our administrative office in Aurora and a smaller satellite office in Elgin. Historically, as we've talked about, we used to have our administrative office here in Geneva and then satellites in Aurora and Elgin. As we move forward, and actually Mr. Tepe and I were talking about this before the meeting, I think there's a lot of value in us being more centralized, but also we're going to need to provide services to everyone around the community. So that's something we're very mindful as we do our work. I'll share a slide in a moment that shows our different grants, but we're also a little bit unique in that we are primarily grant funded. So when the health department was established, we do have a special tax levy that's specifically for the health department. That has been about just under $2 million for the past 13 years or so. And as I've mentioned, that's quite a bit different than other communities around us. But we really live on grant funding. And there's people view this in different ways. In terms of, some people view it as an opportunity to say, oh, great, the department can go out and get their own money. And that's true. And it is exciting. But each grant has a specific timeline and deliverable. So we really look at every grant that we get. We sign a contract that says we're going to do XYZ deliverables within the time frame of that grant. Many of these grants are 1 year. In the case like of the Children's Mental Health Grant that Ms. McCormick mentioned, that was a 7-year grant. That's quite long in the grant world for us. So that has a big impact on how we look at delivering services in the future, just in terms of the grant cycle. And part of this is Kane County, but it also, the siloed funding is a common theme for public health across the country. That's a problem that we have is staff that are working on that grant. We are signing and saying that this is what they're spending their time on. They're not working on other projects. We can't choose. We can't get a grant for teen pregnancy prevention and have that person spend all their time on lead poisoning prevention. We have to do what our funders ask us to do because we've entered into contracts with them. And we do have a balanced budget every year, though the community need is quite great. So this is a look at our current funding as we're set up as a health department. So what you're seeing here is that we currently are operating with 26 different grants. So again, those are 26 different projects, 26 different contracts. 26 different sets of reporting that we need to do on a monthly, quarterly basis. So it's fairly complex. Just as a reminder, and I've got our org chart as the next slide, but you can see we're set up as 5 divisions, 1 for our finance and facilities, and then 4 that are more operational. So we've got a great group of directors here who are doing an outstanding job leading this work in planning and information management, which is a newly formed division. So that's something that we just created within the last year as part of the effort to increase our ability to provide real-time data to community partners and to help us more effectively plan our programs internally. Community health, which includes a lot of our outward-facing kind of community partnership programs, which includes our mental health expansion. Disease prevention, which has not only our home visiting, but also our immunizations programs, high-risk infant follow-up, a lot of good programs there. And health protection, which includes all of our environmental health and our communicable disease control. So following up when diseases are reported to us. So lots of great work. And as we talk, and I'll emphasize this a couple times this morning, as we talk about how, in my viewpoint, we're underfunded as an agency, I just want to keep coming back to what a fantastic job the people at the health department are doing. We've got some stellar staff who are really making a difference in people's lives. So it's really exciting. Here's a look at our current org chart. So right now we have just under 75 people who are on the books as employees. We have 9 openings right now. Several of them are new positions that have been funded. So we're just in the initial hiring process for those, which includes 2 staff members who are going to be working in our behavioral health expansion as part of the ARPA funding that this board has approved for us. So again, lots of great work. And I share this as we look at what's next for the health department. This is what we're growing from. So when we talk about what programs are next, it's the expertise of the people who are listed on this chart that are filling in all these boxes. They're the ones who are really driving our growth and are really identifying where there's both needs and opportunities for us to move forward. So I wanted to look at 2 simple things. I'm pretty simple myself. So the simpler we can make things, the better. So I just want to take a step back again and look at what are some things that we're trying to accomplish in public health, just at a high level, and then talk about how a new facility is going to help us with that. So there's a cycle of infection. So for infectious diseases, they don't just happen. There's a cycle. And so I'll start in the kind of upper right there at like 1 o'clock on a clock. You have the pathogen. So what's the thing that's making people sick? This could be rabies. This could be COVID. This could be flu. This could be a sexually transmitted illness like syphilis or gonorrhea. There's a whole host of things that are out there in this world that can make us sick. So you start with whatever that is, bacteria, virus, et cetera. And that is somewhere. Maybe it's in people, maybe it's in the dirt, maybe it's in the food that we eat. I just watched a special on Netflix this chilly weekend talking about how upwards of 20% of the chicken we buy in the store probably has E. coli, which is one reason why we talk so much about food safety, right? So bacteria and viruses are all around us, and they ebb and flow through history in terms of the impact they have on us. They leave us somehow. So if a person is carrying one of these viruses or bacteria, that leaves my body somehow. This is how it works. I either cough or sneeze, or there's close contact, or it can be through poop, which people don't like to talk about, but hand washing, especially in our food establishments, this is really key. But anywhere people need to be washing their hands, and it's such a basic thing. But this causes a tremendous amount of illness every year. There's different ways that these I'll just simplify for a second and say bugs, could be bacteria, viruses, et cetera, like I said. But these bugs can travel through the air. So maybe it's in a droplet. So it's going to be in the air, but it's going to settle down pretty quickly. What's even worse is something that's airborne that can circulate. And as we talk, and especially at the early time in COVID, we're really speculating and learning like, okay, how long is this going to be in a room? How long is this going to settle on a doorknob or a table that I could touch it and get sick later? So this is, I remember you take a book back to the library during COVID and they put it in a room for 2 weeks just to make sure it was clean, right? So there's different ways that we can have these bugs get transferred from person to person or from host to person. Then it has to get into my body somehow. To get me sick, it has to get into my body. So that means I either have to touch my mouth or I have to eat it or I have to touch my eyes. I have to breathe it in. I have to have close physical contact with somebody. I have to have cuts in my skin. Somehow, in order for me to get sick, it has to get in my body. And then different people are more susceptible. So we frequently look at infants. We look at the elderly. We look at people who may have health conditions. And this is something I learned almost 20 years ago when we were looking at restarting the smallpox vaccination campaign here in this country. We started looking at, well, who has health conditions that may put them at risk? Who has pre-existing conditions? And over 50% of people had conditions that would put them at risk. And we saw this in COVID too. So we're not just talking about like, oh, it's just a small number of people who are what we would consider immunocompromised. Many people are walking around with conditions that put them at elevated risk for illness. So thank you for bearing with me for a second with that. Want to say that at any place around this cycle, we have interventions that we can put in place that can stop the transmission of these diseases. And when we build a new public health facility, when we do our program out in the community, that's one thing that we're trying to do. So as we look at, and I'll just use it quickly, our food program as an example, we have 8 inspectors. Last year, they did over 2,700 investigations, upwards of 70 foodborne illness investigations that they did. As we look on the prevention side, we're out inspecting restaurants. We're educating staff. We're assuring that the staff that are in the places where our residents go to eat, that they have the proper training, that they know how to handle the food, how to handle their employees if people may be sick. We had a case, I think it was when the Bears were in the Super Bowl. So was that 2006, where we had 1,000 people that we had to give shots to because they may have been exposed to hepatitis in a restaurant because somebody who was ill may have been touching the food. So if we can be preventive on that and make sure that the restaurants step in ahead of time, that's going to save a lot of illness on the backside. Portals of exit, again, are people doing proper hand washing? We set up and do, I think it was 270 temporary event inspections that we did last year, making sure that if you go to a market, if you go to a concert, if you go to a food truck, that all of those things that people have the proper things in place so that they can clean their food. Just a couple of other examples that I'll use. COVID, certainly, and I know people are sick of talking about COVID. You have a pathogen, you have a reservoir. Well, if I may have been exposed, that means now I'm one of the people who may make other people sick. I've already maybe been exposed. This is where we tell people stay home. Where now we say, okay, if you're going to be out, make sure you're wearing a mask because that's stopping those portals of exit. So it makes it harder. If we have a place where we can do training, if we have a place then, if people are sick or are about to be sick up at susceptible host where we can provide immunizations so that we can make it so people aren't as susceptible, having a space that's just dedicated to doing that, not only for COVID, but for childhood immunizations. One thing that we're really excited about with a new facility is being able to have a bigger clinic area where we can get people in and we can get people immunizations. We can have an area that's more friendly for families and for children where we can have them in there so that we can protect people so that susceptible host, we take that off the block and then somebody's less likely to get the illness. Same for sexually transmitted illnesses, same for TB, same for West Nile virus. Difference with West Nile virus or with tick-borne illnesses. Rather than it being a person who's getting you sick, it may be a vector in the community, or what we call a vector, which would be an animal, an insect, something like that. But that requires us to have space to do surveillance, space for a lab where we can come in. We actually have someone who collects mosquitoes every summer, brings them back. We have, and it's probably the stinkiest. Well, there's quite a few stinky jobs in health departments. I mean, don't drink out of all of our fridges. I would definitely say that. But where we go and we collect mosquitoes, bring them back, smash them up, and identify where in the community are pools that may be positive for West Nile virus. So with a new facility, it's going to give us space where we can bring people in, increase the services for communicable disease, both for education, for outreach. Also gives us more space for staffing. I talked about how we have only 8 inspectors for all of our restaurants that we have, all of our food establishments. That's not enough. We have a couple of vacant positions that we're trying to fill. But as we look out into the future, hopefully, it's been a pause and it's been a really rough time for food establishments during COVID. Hopefully, as growth starts up in this community again over the next few years, we're going to see more and more restaurants and eating establishments as business picks up in our community, which is going to require us to have more inspectors. And again, I'm talking 5 years, 10 years, 15 years into the future. So for infectious diseases, it's this simple. There's diseases, and they leave somebody somehow, and they get into somebody else somehow. And at each one of those steps, we have programs that we can do in the community. And again, having a facility where we can bring people in is extremely helpful in being able to break that chain of transmission. Want to switch gears a little bit and talk not in the infectious disease world, but more holistically and talk about behavioral health. I'm going to touch on ACEs, which are adverse childhood experiences. Director Peterson's team is trained to give presentations on ACEs. So this is, if you're not familiar, things that happen to people when they're young that have a lifelong impact on their health. And the original ACEs research was done about 25 years ago in California. One caveat is it was mostly white insured people who may have had less stressors in certain areas. They had access to healthcare. They weren't dealing with some of the other community things that many people in our country deal with. But really looking at neglect, looking at divorce or loss of a loved one, those things we can measure. And the more ACEs someone has, you can do this and give yourself an ACE score. We can directly correlate that with negative health outcomes. So there's issues with brain chemistry changes. There's issues with ongoing physiology changes. This can impact people's likelihood to be obese, people's likelihood to smoke, people's likelihood to engage in dangerous sexual behavior, people's likelihood to develop hypertension and diabetes, their likelihood to end up in jail. So what happens, and you've heard me say it here, to me, the number one area we need to focus on is early childhood. How do we focus on early childhood? I think one of the biggest things we can do is supporting families. And I think as we heard from the Parent Council this morning, that's extremely important, because if we can support our residents and provide filling in some of the gaps and help people link to other services, that's going to have a tremendous impact on chronic disease, infectious disease, et cetera. Down below the line, and I'm a big fan of this graphic because I think it just shows some of the different things that impact decisions that we make when we're going through our lives. But obviously you have other things in the community: poverty, violence, racism, poor housing. That's something that certainly we've heard about over the last few years, that's a problem that continues to get worse nationally. We have people on waiting lists at all of our shelters right now. So housing and affordable housing is an extremely large stressor for people. And then lack of opportunity, economic mobility, and social capital. I've talked about loneliness. This is something that social isolation, we've talked about with COVID, that it increased. We talk sometimes about these stupid phones, and especially young people with social media. maybe good news, teen pregnancy goes down because you can't get pregnant if you just are sitting in your room on social media. Unfortunately, there's a lot of negative things that I think we're just scratching the surface of starting to see for both adults and for young people in terms of what that does to our mentality and that isolation that creates. So similar to the cycle that I showed for infectious diseases, when we look at our community, we know people can be exposed to certain things which increase their risks for negative outcomes. We can have programs that we put in place that can reduce the likelihood of those negative outcomes, or if people are already experiencing them, we can help them with additional education. So just a couple of examples, and this is a study that came out of the CDC about 4 years ago, just looking at if we reduced ACEs in our community, what are they projecting we would see? So a couple things I'll point out. So almost half of the depressive orders that we see now. So this is something that more and more people are seeking mental health assistance. A lot of it can be tied back to ACEs. And again, this is something that's very personal, talking to people about what's happening to them in their lives. So we have to be very mindful of it. But we know from national research that when we talk to people and having 4 ACEs for those negative things, so whether it's negligence or abuse that people may have experienced, 16% of Americans have had at least 4 ACEs. So there's a huge correlation between negative outcomes, and this isn't just bad behavior. There's physiological and brain chemistry changes in people and there's a lot of good reading out there. The Body Keeps Score is a great book that people can read if you want to learn more about it. But this has a long-term impact, and that hurts people. It hurts families, and it's very expensive for all of us as we pay for healthcare, as we pay for people to be incarcerated, as we pay for people who are struggling with mental illnesses that may be exacerbated by having experienced trauma in their youth. So you can see health risk behaviors. We'd expect 1/3 less people to smoke if we could do a better job of reducing ACEs, 1/4 less heavy drinking if we could do a better job of responding to ACEs. And I'm spending about 3 minutes on something that we literally can dig in and spend hours on. So this is just a high level. But again, just like with the infection control cycle, these things are out there. These are things that our residents are living with. This is the background. This is the landscape. Now, what does a new facility do that can help us as we look at expanding our programs? So the goal is that this becomes a hub for connection, for education, for learning. This space where we can have a training facility where we can bring people in. This is not only for residents to come in and get training, to learn from peers, to get that support, to get education, but also, and maybe something that would be used even more, is a place where we can bring our partner organizations in. So we can bring peers in, because it's hard to find these spaces where we can offer these types of trainings for up to 150 people, where we can be there, we can collaborate, we can be in person and really learn from each other. So that's going to be a huge, huge asset. Looking at support services for people who maybe we can help them avoid a negative situation. And situation, just like I said, bug, I'll put situation in quotation marks. That's just a generic term, helping people respond to and recover from negative situations. What's a negative situation? Maybe somebody's just getting out of jail. And it's really exciting working here in Kane County. I've said this a lot, having a state's attorney who's very proactive, having a sheriff who's very proactive. These programs that we have to help people get out of jail, say, well, why are we investing there? You know, if I'm doing work and I'm doing what I should do, how come we're putting resources in to help somebody who's done something wrong? And I think, again, I'll go back to this slide. We know when we look at people who are in the juvenile detention center, over 90% of the young ladies who go through our juvenile detention center have been sexually abused. That's not their fault, right? So we know, we can predict. I can say a baby who hasn't even been born yet, if they are sexually abused in their life, they're much more likely to end up in our correction system. That's not their fault. We all are responsible for our decisions, yes, but we also have absolute proof from around the country, from decades of research, that shows When we expose people to violence in their homes and untreated mental illness in their homes and people who are using substances in their homes, that is going to have a negative impact on that person's life. There's hope, there's things we can do, and certainly we can intervene, but we need to be able to hit this from all different directions. So focusing on people who maybe have had a harder time, which is a lot of people, that's one area. So it could be somebody who has a newly diagnosed mental health condition or a family who has a newly diagnosed mental health condition. Switch it up a little bit. Could be somebody who has a new diabetes diagnosis. This is an area where it's one of our top 3 priorities, looking at healthy eating and a healthy weight and active living. Diabetes is a big contributor to a lot of mortality in this community, a lot of death in this community. With a new space where we could bring people in, we could work with partner organizations so that we could provide more education, that creates an opportunity for us to dramatically reduce the amount of illness that we see in the community. And then one key thing that I like to support is we're not looking to reinvent the wheel. We're not looking to kingdom build here. This is about partnership. We have awesome organizations that are doing work every day, whether it's mental health, whether it's chronic disease prevention, helping people get jobs, helping with transportation, helping by providing direct medical care. We want to be able to utilize this space to bring people in, to be a resource for our community so that we can lift up what's already going on. And the health department, as part of our assessment process, will continue to look and see where's the gaps, where are the areas that we need to be doing more. And there's been some conversation around kind of what's the work plan or what is the assessments that's been done. And I'll share this is our 2021 community health assessment, community health improvement plan. This is a robust process that we go through to identify what the gaps are, what are the needs, what's making people ill, what's making people really suffer in this community, and where are opportunities. This is 2021. We've been talking about our current process where we've just finished over 2,000 interviews with Kane County residents to find out about their health conditions. We've been conducting focus groups with Kane County residents to find out what are you seeing? What are you hearing? What's happening with you? We also have a team in which we've just built up over the last year of statisticians and epidemiologists who are combing through all of the data that already exists out there. What's happening in the hospitals? Who's coming into the emergency room today? Where's the gap? What can we do about that? And the way we work in public health is we take all that information, we identify collectively with partners, we identify what our priorities are, and then we look to put evidence-based interventions in place. So this has been our guidebook. Again, I've talked a lot about how mental health was the #1 issue, substance use was the #4 issue, healthy weight and active living and healthy eating is on there, and access to healthcare, communicable diseases. These are all things that rise to the top. We also have identified that as a health department, we don't do much for seniors. And by much, I mean practically nothing. So that's an area where we know there's great need, and some of that crosses over with mental health. Some of that crosses over with transportation. So we've identified it on the edges, but with a new facility that we could use as a hub, there's a lot more we could do. In some cases, that's us doing new programming. In other cases, it's us providing space and resource for existing organizations who are already doing things. And then behavioral health, education, I mentioned senior services. I want to just tie back though, the way we're funded in public health, especially if we're largely dependent on grant funds. And I think Ms. Juby asked an excellent question. I think it's 2 weeks ago, maybe at the ARB committee. Do we have a staffing plan for all of these things for 5 years from now, for 10 years ago? We don't, because that's not the way funding works. If we have more local support, then we can do some of that. Now we can put numbers to it and say, here's what the need is. And then we are actively working on getting additional resources that we can bring into this community. I just met with some county departments yesterday. We're looking at there was a grant writer for the county that's been budgeted. So we're looking at that. We're looking at other opportunities with there's legislation that was just introduced just this week where I'll be working with Ms. Gumbs, but to increase public health funding statewide. So we're working on grant writing, we're working on legislation, we're working on more support locally. So there's a lot of avenues that we're looking at to drive local programming. And we've talked a little bit about return on investment. I had some questions. So just looking at some of the research, and I think this is an area that can be challenging for public health, because one thing that people say is when public health is working, nothing happens, right? The bad thing doesn't happen, but that's a little bit harder to quantify. So some research, and thank you to Director Alleman and her team for pulling some recent numbers for us. There was a study out of Maryland that showed for health departments that offer behavioral health services, there's a 25% reduction in avoidable hospitalizations. And I'll make a point here for public health. And this return on investment, I think the way I view the health department and hopefully the way we view ourselves as county government, we're all in this together. So some things, it's not money coming back to the county. As we talk about supporting the business community, that's really to support people who are entrepreneurs and who are doing businesses in our community. As we talk about reducing hospitalizations, good for the individual who doesn't have to go to the hospital, but we all pay the healthcare costs for anybody who goes to the hospital. The county pays it for our insurance. Everybody pays it. So these costs don't just go away. So this is something that I think reducing hospitalizations, that's not a dollar figure that we can say that comes back to the county, but it's a tremendous savings for our community. NORC out of the University of Chicago, where they do a lot of good research, showed that for certain mental health programming that you were getting a $4 return on every dollar invested. In Michigan, they just did a study that showed for childhood immunizations, which again, our childhood immunization program is much smaller than we'd like it to be right now. If we had a better space where we could run more clinics and really be able to engage more people, we'd be able to see better results, especially coming out of COVID. There's more vaccine hesitancy, which is problematic because we've done a good job in this country of reducing these diseases and we need to keep doing it. In Michigan, the study found that they saw a $22 return for every dollar invested in childhood immunization programs for flu. And we do less than 500 flu shots a year, and we could do a lot more than that. $11 returned per dollar invested. That's again, that same study that came out of Michigan. And then finally, looking at lead poisoning, there's a lot of discussion about lead service lines. We have a lot of old houses in Kane County where we work a lot, where children are exposed to lead in their homes. So this is a big program for both Director Onwuda and Director Barrett on the environmental and the clinical side. But studies that have come out, the CDC has found between $17 and $221 returned on every dollar invested. So if we can help a child avoid being exposed to lead, or if we can get them out of a situation, do remediation in that home, that's going to save us as a community a ton of money moving forward. So I just wanted to back up again. We can look at how we stop infectious diseases, and then kind of similar maybe logic. There's things that happen to us in the community, excuse me. And then there's ways that we can intervene. Sometimes we can do prevention. All right, is that my time up? I'm kidding.
No.
There's things where we can do interventions. Prevention is the best, but frequently it's too late. So there's things that we can do in place. We're working to expand all of these programs. So again, I'm happy to sit down with any board members. If there's questions we can answer publicly, love to do that. If it's something you really want to drill down into and get into the numbers for specific areas, we're happy to do that as well. And then I'll just close with coming back to our staff. This is the team as we talk about, and it came up at the committee of the whole, we used to have 150 employees 15 years ago. Now we have 75. So we have half the people doing the work in the health department now that we had then. This is a fantastic group that is really doing tremendous good every day. This is a tremendous value for taxpayers and for our grant funders. So as we talk about where we're going to expand and where we're going to improve our ability to serve the public, It's the brains that are represented in these little boxes here that are going to be doing it. So with that, I'm happy to answer questions. We do have a couple of resolutions, so I'll defer. I don't know where you want conversation.
Does anybody have any questions for Michael or comments? I would just like to say that not only the numbers that you cited, we also can factor in the fact that they are then a contributing member of society and pay taxes and hold jobs and make a contribution to the society without those other things. So it keeps on going. It's
Yes.
a gift that keeps on giving.
Yes,
right?
and I think one thing that sticks for me, thank you for that comment. The perfect community, we have a safety net, and this is subjective, but the perfect community, we reach a point where we don't need all the programs, right? And to the speaker earlier, like, yeah, I agree. We want to move to where we don't have to have all these programs. We don't have easy access to high quality childcare in this country like we should. Our schools, we struggle sometimes. So there's lots of supports that we need now that ultimately move us to where, like you said, Madam Chair, that we have people then who are paying back into society. Absolutely.
Mr. Sanchez?
Thank you, Chair Strathman. Michael, just talking about, that concept of adding resources and, are we going to build a new building and then have to come up with money to fill it with people? It just gets me thinking what we're doing now. It's so grant dependent. So resources come in when the money comes in, financial resources. So are there grants that we're passing up now because we just don't have the facilities to operate those grants?
Yeah, I think there's, excuse me, there are more grants out there that we could find. So I think last week I mentioned that we're now hiring people that we don't necessarily have desks for yet, right? So we're in this transition period. So there's more capacity we can build to be able to get more grant funding. Absolutely. There are occasionally grants that we'll pass on just because we don't have the bandwidth or the physical space, to your question, to be able to fully implement something in the space we have. And I can't remember if I joked last Monday, I had to send an email to staff saying, make sure that too many people don't flush the toilet at once because the toilets in our basement were backing up. That's kind of funny. It's odd. It's gross. But we're in a competitive market trying to recruit and retain good, high quality employees. And we're saying, here, come work here. And sorry for the mold. I actually, Director Alleman contacted me, was that Sunday night, and said, hey, staff just showed up at the building to pick up supplies for a training we were doing. And one of the doors was open because mechanically we were having an issue with the door. So we had to go get the police, walk through the building because we don't know why is the door open. But it turned out to be a mechanical issue. But these kind of things, just in our current state with our current funding, make it hard to recruit and retain good people because they kind of walk around, excuse my language, they're like, what the hell is this?
Yeah.
Like, what's going on here? Whereas a new facility is going to help. But again, it's not focused on the employees. It's focused out in the community. And I think that's where we're going to be able to get more opportunities. We here in Kane County being kind of in this ex-urban area, so we have a lot of things that make us really appealing to funders. We're right on the edge of Chicago. We have this beautiful, I think, diversity where we have lots of farmland over here, right? We have tremendous diversity in our populations, both socioeconomically, ethnically. The highest percentage of Latinx or Spanish speaking residents per capita is in Kane County. Out of any county in Illinois. So we have lots of things that funders find interesting about us that maybe they could replicate in other areas. So as we continue to build our capacity, it's kind of, and this is a long answer, but it's a little bit of there's grants out there that we don't have the facilities to do, but it's also there's opportunities we can create with funders and opportunities we can create with higher education that if we had a better facility, we would be able to do more.
Okay, thank you. And I had one more question if I
Yes,
may.
go ahead.
At the committee of the whole, there was a question asked about how many residents are served at the health department every week. And I think that kind of question probably comes from just a lack of understanding of the context of what our health department does. We have ideas of what a health department should be doing, or it's, but what we're actually doing is a little different. So looking at your chart with all of the grant programs that we do have, 26 grants, we're only seeing 10 people, that was off the top of your head, at the building every week. But with all these grants going on, does that mean we're serving residents out in the community?
Yeah, absolutely. And we'll continue to serve residents out in the community, definitely. But in terms of foot traffic through our building, which helps every one of our programs, it creates education opportunities. It creates ways for us to link people into other programs. As we increase that traffic, that's gonna be very positive for all of our programs.
All right, so having a bigger space will help those programs. It'll bolster them. We'll see more people coming through the health department building actually, and not just out in the community. But again, that's that thing we don't really see. So it's kind of hard to keep that in mind, that we're not like the health department we think it should be in our imaginations, right?
Yes, yeah,
Okay.
yeah, good
Thank you.
point.
And people wanting to work in a place where the bathrooms were.
Yes, right.
Yes, Madam Chair.
Thank you so much. This has been an enlightening conversation and presentation, and I thank you for putting this together. Yesterday, I had the opportunity to meet with the executive director of VNA Healthcare, which is a countywide healthcare not-for-profit organization, an extraordinary program. They are building, as you may know, Michael, I know, they are in Copley Hospital, the old Copley Hospital. They've taken over 2 floors and they're renovating it for health. And this is, if you're not familiar with it, and I'm sure Michael will speak much more eloquently than I can on VNA, they are countywide. They don't ask necessarily for your payment for services. If you can provide payment, fantastic. If you have an insurance card, fantastic. If you cannot provide that, don't have those resources, fantastic. That's their mission to serve. Well, one of the things they shared with me is the first floor is going to be the clinic, health clinic, and they are doing fantastic work there. They see people, there's not a long waiting list. They've extended it out, made it larger to serve more people. But here's the interesting issue that you were bringing up. And the reason I came up to talk is they've got the second floor, which is the build out. Now, they asked me if Kane County could help support them with some money. And I said, no, Kane County has no money. So at this point, and I have to be honest, because we don't have the resources to provide for them for a build out. But what they shared with me as part of the data is the fact that there is to see services for mental health right now, even though they're expanding it out, they're expecting anywhere from a 2 to 6 month wait just to get in, even for critical services, with the expanded footprint that they're putting out. And this is countywide. So the need that was expressed, and the reason it came up, is that this is a sincere problem that we're having in Kane County with mental health issues. I don't know why, maybe because people are more aware of it, and that's a good thing, to seek help, to seek the counseling. But anything, in my opinion, that can be done to provide those services to help people out so that they can function well, contribute to the communities, don't continue the bad behavior which they pass on to their children, who then replicate that because that becomes a norm for them, is something for public health and for the mission of Kane County, to me, is vitally important because it returns, no matter what political spectrum. If you are abusing your child because you've been abused as a child, it goes beyond politics. It just goes to health, wellness. So thank you.
Any other comments or questions? Okay, that was a very excellent presentation. Thank you for that. Thank you.
Not a meat on that.
Yeah, there was.
And I see our guests leaving, and I just want to say thank you again for being here this morning. Thank you very much. Okay, now we got some business to go to here. You want to start with the resolution, Michael?
Absolutely. So, and I want to apologize for the timing on the resolutions. That's my fault. I thought we were hitting in by the deadline to get it in the packet. Everybody should have copies of the resolution now. I'll start with Resolution C, authorizing agreement with the Illinois Department of Healthcare and Family Services, HFS, which allows Medicaid presumptive eligibility determination. So what this resolution will do is it is a contract with us and the state so that somebody who doesn't yet have Medicaid but could be presumed to be eligible, we would be able to bill for services. So as we look at being able to expand different sources of revenue to bring in to be able to provide more for our residents, this is an agreement that putting this in place is going to allow us to do it. Now, in the agreement, excuse me, in the agreement, there is some question about liability. And in our conversation with the state's attorney's office, anytime that other party is not willing to remove that indemnification language, that requires us to come to you as our policymakers. So, and I don't know if there's any comments from the state's attorney's office or not on that. It's pretty straightforward. And I think we feel pretty safe that it's a state. This could technically be an intergovernmental agreement, but that's not how they framed it. Anything else? Okay. So I think it's pretty straightforward, but just because of the indemnification, we just need your blessing on that.
Any questions about this? Okay, I'd like a motion and a second to approve.
Sanchez moves.
To vote on, rather, I should say. Sanchez moves.
Juby second.
Juby seconds. Okay, please.
Juby,
Juby, aye.
Silva, and Tarver,
Tarver, yes.
Williams,
Williams, I can't vote. I'm remote and
that's
I had an emergency at work, so I'm sorry, I can't vote.
yes, thank you. Young,
Young, yes.
Sanchez,
Silva, yes.
Sanchez, yes.
Okay,
Silva,
we
I got you.
Dr. Silva.
Silva
Thank you.
Sanchez.
Thank you. Got you, and Strathman.
Strathman, yes.
Passes.
Okay, passes. Okay, another one?
Resolution, what's item D on the agenda here is authorizing an increase in headcount for a new grant-funded home visiting nurse position. So when we look at interventions, I can tell you, home visiting is one of the most researched interventions that we have that shows a tremendous return. It's $8 or $9 per dollar invested in this. This is really getting in with our program, which we call Kane Cares, which the Kane County Board has been very supportive of for the past 28 plus years. This program is a nursing model. It's a nurse family partnership where we go out and we work with first-time mothers before they give birth, and then work with them for the first 2 years of that child's life. Tremendous outcomes. And again, in terms of return on investment, a child who participates in this program, a mother who participates in this program, well, that child's much less likely to be in jail when they're 15 by participating in a program like this. That's just one outcome. There's actually tons of support and other things that we do. This position we did fund because we were expecting this increase in grant funding. So it is in the budget. So there's no budgetary change that needs to occur as part of this resolution. This is simply authorizing an increase in headcount for HR so that we can create this position.
Okay, could I have a motion and a second if possible passing of, yes. Yes, Ms. Judy.
How long is this grant for?
Well, we've had it for over 20 years.
Okay, so it's a recurring grant,
Yes.
so we are not anticipating that it's going to go anywhere.
Correct.
Great, thank you.
Sanchez moves.
Sanchez moves.
Oh, Juby second.
Thank you, Ms. Judy.
Sorry.
Thought you were going to move it. I do have a question.
Yes, Mr. Sanchez.
Mr. Isaacson, Director Isaacson, with this program, it's just for a short time,
Yes.
right? Because I mean, we send our children to school to learn, reading, writing, arithmetic, that kind of thing. We don't just expect them to figure it out on their own. So with this program, it's kind of like we're going in there, providing a very specific timeline of education and then getting out.
Correct. Yes. And I don't know, Director Barrett, do you want to say anything out? It really, I mean, it's the family who's, we're not teaching the 1-year-old. It's really the parents that we're working with.
Mhm.
Yeah, Laura Barrett, Director of Disease Prevention that oversees the Cane Cares Nurse Family Partnerships, which is our home visiting program. We work again, as Michael had said, first-time moms, wherever they're at, and we try to reach them before their 28th week. So we're working on maternal mortality rates, which is extremely low. Illinois is 39th, I think it is, out of the 50 states for maternal mortality. So we're looking at having a healthy baby, having mom have the education and resources to understand what's going on. And because this program is a little different than our other home visiting programs in the county, these are run by nurses. So they have that medical background that they work with these families with. We have lower preterm births. We have lower mortality rates. We have better birth outcomes with these programs. So the financial dollars that Michael's talking are is one piece. Then that nurse, same nurse, follows that mom all the way until that child's second birthday. And they are handed off to early childhood programs, preschool programs. The idea is to have that child ready for kindergarten as best as we can. We work with those moms, set up those goals so that they are self-sufficient by the time they get to that second birthday, and they can sustain and take care of that family by getting a job, getting education, they get their GED if they need to get that, whatever resources we need to work with them to have them be able to maintain and take care of that family ongoing afterwards. So it's very intense. They meet with these families pretty regularly, at least weekly, at least an hour, hour and a half. Evidence-based, over 45 years worth it's gone. If you've ever looked at this program, Google it, look at it, Nurse Family Partnership. It's out of the University of Colorado. It is all over the country, and they have phenomenal results. Our children have 100% immunization rates by the age 2. They have the breastfeeding, decreased smoking, all those type of things, you know, alcohol, we're working with moms with substance use, intimate partner violence. We're working with all these ACEs that we talk about that the mom has maybe had in their past to break that cycle so they're not putting this onto the child. We have decreased emergency room visits. We have decreased DCFS issues going on with these cases. Sometimes we have to work with those because there might be a partner that might be having a case with that. But they work with probably the most challenging cases in the county because of their high education and the extensive training that these nurses have. So we're just really excited about getting this funding back to be able to put another nurse out in the field to help another family.
And I don't know if you know off the top of your head, but would you say that the majority of the clients or whoever you serve are teenage or under 21?
I think our average age is around 20 now.
Okay.
We have some teenagers, but we have some that are in their 20s too, that, you know, just because of what they're dealing with in their personal life, that we're trying to help get that support to them. So again, so everything Michael talked about with the ACEs and those past experiences, that we can help to get them the support to be self-sustaining. We've got graduates from this program. As Michael said, this program's been going on for 20 years here in Kane County. We have teachers out there. We have nurses out there. We have social workers out there that have been through this program and have gone on to got their masters and are very sustainable and very strong in our communities. So it's a wonderful program.
Yeah, and so the mothers coming to it, they just don't have those kinds of resources in their life and their family and friends. I mean, so many of us were fortunate to grow up with a good support system around us, but is that true? Of
That's
the
correct.
cases you're
There,
seeing?
we work with the homeless shelters. We work with people that are house hopping, you know, couch hopping, you know, with it. So whatever that issue that they might be dealing with, again, substance use and can sometimes be in there. So whatever we can do to get, again, a healthy pregnancy and then a healthy child to get them a healthy start. So it's to break up that whole cycle of what's going on there.
Thank you.
Gums, did you have a question?
I do actually. On the,
Get your
You
mic
guys-
nice and close, please.
do you guys offer resources as it pertains to home health birthing? Statistically, Black women are 3 times more likely to die during childbirth. And I know the trend is going to home birthing. And I wonder if that's something that we address regularly or,
This program works with whatever the mom wants to do. So if that's what a mom wants to look for, we can help with resources to do that.
and if I could interrupt, the reason I ask that is because a lot of moms don't know that's available. So
Mhm. Right. We work with doulas, we work with, nurse practitioners, providers, midwives. We work with all of the hospitals here in the county regularly with all their cases.
that's great to hear. Thank you.
I was just going to add to that. We are aware of the Black maternal morbidity rates going up, and that's something that our early childhood folks are looking at the data and trying to see if it needs to be prioritized, as well as we work with doulas. Our latest podcast episode goes really deep into doulas and their positive impact on those type of dire statistics. And we use our IRIS system to refer families to get more information about doulas and other home birthing options that often lead to better outcomes for those certain types of folks. But we do offer education on all of those things, yes. We hope to do more.
And this is Director Peterson, our Director of Community Health. Can you share the name of the podcast just so people can find it?
It's called Cane Health Talks, and that's my team that hosts it. And we have a couple of pediatricians coming on to talk about picky eating and sensory issues, screen time. Like I said, we talked about doulas, we talked about parenting through the holidays. So there's a wide variety of topics that we're going to be covering. We have local experts that come on and talk to us. So maybe we'll ask one of you sometime to come talk with us too. And Gale Borden Library has an amazing podcast set up with editors that can help you if you're interested in a podcast. It's a really amazing facility.
Mr. Roth?
Hi, Roth here. Is the grant federal grant or a state grant?
This particular grant is actually a combination. We have Riverboat funding that's part of this. We have State Board of Education that funds this program as well. So it's a combination.
Okay. So the people we're helping do not have to pay anything. The grant covers all costs?
Yeah, absolutely.
Okay. And we've been doing it for 20 years. What % are we reaching the population? And then the other question is, what part? Is it mostly, Elgin and Aurora, or is it all over the county?
So again, this program is unique in Kane County that it covers the entire county. So it does not matter where you live as long as you live in Kane County.
Okay.
With it. So we cover the entire county. Some of the other programs have, due to their grant restrictions, have from the schools and healthy families and parents as teacher programs or other home visiting programs that we have. We have 12 of them all together in the county. They have geographic locations,
Okay.
but they all have to be low income. So
Okay.
these are all
So
low
that is the one
income
requirement.
families. So if
Okay.
you've got commercial insurance, you're not going to be qualified.
Right.
If you are uninsured, underinsured, Medicaid, this is the type of program that you would
Okay.
qualify for.
And then what % would you say we're actually reaching of that population?
For all home visiting programs,
Because we're not reaching 100%, I would assume,
no,
right?
nowhere near, nowhere.
and I
near.
understand.
I think we're less than 5% of
Okay.
the.
And what, in a perfect world, what would be our goal? I mean, that may never happen, and I understand that.
Yeah, funding for these programs is limited. Of
course.
In all locations, because it's all grant funded.
Right.
But ideally, it'd be nice to be able to get out to 50%, right?
Okay.
Because that would make a huge shift in what happens in the next 10, 15, 20 years for our population if these families have that support to begin
So,
with.
and then we've documented the return on investment, meaning, like you said, for every dollar we invested, we've potentially saved. Because I think that's important to say, this is not a money pit.
Yeah, and I think that's something where we really are dependent on other research. We don't have the funding to necessarily
do that
follow up with
reporting.
everybody, right?
Okay, all right. And then like you said, by the time the baby is 2 years old, they go on to something.
We hand them on off to if that's what the family wants,
Right.
it's all by what the mother and the
Yeah.
family wants to do. But we have those resources available. We use
Mhm.
IRIS, obviously, and coordinate with all of our other programs in the county and where they're located. and what makes the best fit for them. So they can go into a preschool program. We help them with childcare services if mom's going back to work. And then whatever it needs to be to get them ready to get for kindergarten, because that's really the whole goal of this, to have that child as strong as they can be and be ready for kindergarten.
Thank you.
A quick comment. This is our home visiting program, which we're very proud of, and the nurses do a great job. But as Director Barrett alluded to, we also manage a coordinated intake program where we work with all of the other home visiting programs that other organizations in the community may provide. So again, it's this network of us not only providing services that are needed, but also supporting others that are providing similar services.
Mr. Young, did you have a question?
Yes, thank you. David Young. Are there other I'm going to call them nonprofit organizations for lack of wording, that offer this service outside of King County government?
Oh, yeah. Yeah, there's 12 programs throughout the county. This is the only one that's nurse-led. It's Nurse Family Partnership. The other evidence-based programs that are out there are Healthy Families and Parents as Teachers. The Aurora school districts have both of them, East and West, both have Parents as Teacher programs. U46, District 300 up in the Dundee, Algonquin area has also Parents and Teachers. We have Healthy Families, VNAs, which been alluded to from Madam Chair here. They have a Healthy Families program. Kids Above All has Parents as Teachers program. So there are 12 programs throughout. But again, they're very geographically based on what is funded by their grant. And so they do not cover the entire county. Only this program covers the entire county with it. So, but we do have other programs that we work with closely.
Okay.
Mr. Tepe, you had a question?
Thank you, Madam Chair. I pointed out in the past, and I'd like to continue to point it out, that our health department is seriously undermanned in comparison to any health department around us. About 12 years ago, very inappropriately, this board sliced the health department in half at the time. But what I want to say is, if you have a need for underlying services, you want to live anywhere but King County. Go to DuPage County, where DuPage County has at least 120 people in the health department just devoted to mental health. Okay. So as a consequence, our health department has figured out how to provide basic services by getting grants. Okay. By supporting 501c3s in particular and helping that sector grow. And I know Michael has held a kind of a quarterly program for years, building up cooperation among these 501c3s. The IRIS program that has been implemented that allows them to refer people between them has been an additional incentive for them to be able to effectively provide services. But this board needs to do its job and provide the kind of funding and resources that are necessary for the health of the people in this county. And I'll continue to stand on my soapbox as long as I've got a seat on this board. Thank you.
We're ready to take any other questions?
Madam Chair Silva?
Yes, Dr. Silva.
Just briefly, I haven't chimed in a whole lot because my colleagues have expressed a lot of the thoughts that I have, and I usually talk and advocate and harp on public health. So I've been a little bit quiet because I think my colleagues are doing a phenomenal job. But the only thing that I would like to see is this is such a cohesive effort. And thank you so much to Director Barrett for responding to my question before I even asked it regarding it being available for folks of low income. But I'd love to see something like this just available for women in general. One of my colleagues asked the question about people who don't have a support, women who don't have a support system. And if, you know, if this is particularly for them, and I'm paraphrasing the question, but I just like to share that, you know, childbirth and pregnancy and raising kids no one gives us a handbook, and women of all socioeconomic and education levels struggle at times with raising our children. I speak from experience. There are moments when you just feel lost, both in pregnancy and in caring for your toddlers and your children when it comes to issues of breastfeeding and teething, and we just, for the most part, look to our pediatricians, but less and less people are going into medicine, into those long careers. We're actually starting to see more mid-level careers. So as less people go into that, we need to be able to support seniors as we go further, and we have more seniors than we do young people. And so this is a way to kind of look into the future, provide access and education so that we can have those healthy families that the health department, that we as a Kane County board want. But I'd love to see that across all socioeconomic levels, not only just lower income, but any, because I feel that women in these situations, families need this type of support. So I'm very much in favor of it. Thank you.
Thank you.
One comment. Thank you, Dr. Silva, for those comments. And I think that's one thing as we look at putting a facility in the middle of the county, we must be mindful of where the socioeconomic need is. But to Dr. Silva, one of her good points she just made, many of these issues cross all socioeconomic boundaries. So being located in the Tri-Cities, there's a lot of people who would benefit from that. And before COVID, we were actually looking at a program with the state that would have been universal home visiting, meaning everybody who had a baby would have the opportunity to have at least one home visit, because to Dr. Silva's point, it doesn't matter how much money you have. It doesn't matter. It can be frightening, especially with that first child, if you don't have a strong support network. So yes, yes, and yes to everything Dr. Silva said.
Okay. Clerk, please call the roll.
Juby? Juby, aye. Silva?
Silva, yes.
Tarver?
Tarver, yes.
Young?
Young, no.
Sanchez?
Sanchez, yes.
Strathman?
Yes, passes. Okay, one more for
All right.
today.
So the final one is listed as 8E on the agenda. This is authorizing the dedication of $5 million of health department funding to the new facility. So this chronologically, this meeting happens to be the first step. Obviously, if you were able to participate in committee of the whole, you heard the presentation where you saw what the full proposal was in terms of funding a new facility. This is funding that the health department has been able to build up over the last few years that we would be putting into this facility. It'd be keeping the funding right now, but just really allocating it. And we kind of went back and forth in terms of, do we need a resolution from this committee, being the parent committee, saying, yes, the health department needs a new facility. But then that we talked about, that's kind of just a proclamation. So this is really saying, yes, we agree that we want to move forward with a new facility. And also we agree that the health department should be setting aside $5 million in reserves to be used for that facility. As part of the discussions we've had, we talked about timing with the ARPA funds and that we want to make sure that those are all expended in a timely manner. So we may want to spend as much of that funding first. And obviously we have an ARPA meeting coming up, so I don't want to get ahead of myself, but if the board were to approve that, we'd want to spend that funding first. And then I believe in being transparent. I would like to keep this funding in Fund 350, the health department's fund, so that we can continue to make interest on this funding until we actually need to expend it. So I just want to put that out there. But if we reach a point where it needs to go into a different fund, so that we can use it for the building, at that time, we would make the transfer. That may not even be this fiscal year, depending on how things go.
So could I have a motion and a second and then discussion?
Sanchez moves.
Sanchez moves.
Juby, second.
Thank you, Ms. Juby. Any comments or questions, Michael? Yes, Mr. Young.
David Young. So this is getting ahead of, obviously, the new building hasn't been approved. So you're, in my opinion, you're getting ahead of that process. So I just wanted to make that statement. That's how I see it.
Yeah, thank you, sir. And if I may respond, I think that we've had that discussion in terms of what is the approval process, and the guidance we've received is the approval process is actually the committing of funds to do the project. So this is one step. You're correct. It's not the whole package. So at any point, and this is, you know, 5 out of whatever the total cost would be. The ARPA committee is going to be where the major component is where the request is. So I don't think this is ahead. It's a step that needs to occur. This meeting is first. ARPA could have been first, and this would be second.
Mr. Sanchez?
Thank you, Strath. Yeah, I would say this resolution and the ones coming from the ARPA committee and finance are really just, they're all kind of the same first step to move things forward to the full county board to make a decision. And it just gives them the opportunity to do so. And it's really not even a decision as the county board. It's more as the Board of Health, which Mr. Isaacson reminded us that we are also the Board of Health. And this truly is a decision that is within the realm of that body, even though we wear a different hat in the same seat as county board members. So yeah, again, it's not getting the cart before the horse by any means. That's why we had a committee of the whole first, to just outline the entire process to everybody. And then this is just, by moving this forward, it's not even saying that you agree with the public health facility project. It's just moving it forward to give the full board the opportunity to make that decision as a whole.
Yes, Ms. Bates?
Thank you. As a member of the ARPA committee, I would like to thank you for this idea, this resolution, because I think it shows that the health department is putting your own money into this building before we even, pass it in ARPA. So I'd say you're putting skin in the game. So, good.
Yes, Mr. Roth?
Roth here. Michael, you mentioned about the interest. Is the interest going to be dedicated for also going for the building?
Not necessarily, no, but we're committed to this project. Obviously, this is something that's going to benefit.
I mean, one of our biggest challenges as a board is we have a gap between what we think it's going to cost and the funds handed, because we can't be spending money we don't have. And I know there's opportunities to fill the gap, and that's going to be the probably the most critical path is, are we going to fund the building and be successful? And also answer the question, how are we going to make sure that we don't get dinged by the government from ARPA? And I know in the cow, people say, well, they may come after us 20 years. In talking to some of the state's attorneys, they said, you're normally going to get challenged the very first year. So that's what we need to come up with, the risk analysis. And I was very disappointed that E&Y refused to give us a probability, because that's the most critical thing. They're kind of wishy-washy, which is what those organizations, I think, and that's my feeling, tend to do. But that's our critical path. We got to find funding if we're going to move ahead. Otherwise, we're not going to get it done.
Okay, are we ready to call the roll? Okay, Casey?
Tooby?
Aye.
Silva?
Silva, yes.
Tarver?
Tarver, yes.
Young?
Young, no.
Sanchez?
Sanchez, yes.
And Stratton?
Stratton, yes, passes. Okay. Any old business? I do have, I just want to say the theme of today's discussions has been, it takes a village, I think. And I'm proud and happy to be a part of this village and such a great team. So thank you for everything you guys do. So now I understand we do have a need for executive session this morning. Is that correct? So I need a motion and a second to go into executive session.
Sanchez moves to go into closed session for the review of closed session minutes.
Thank you.
Release of closed session minutes.
Silva, seconds.
Not sure you won't have to have.
Okay. So we can just take a voice vote on that? We have to do roll
Roll call.
call. Thank you.
You want to Madam Chair, you want to remind people to take their,
And if everybody is leaving, please be sure to take your personal effects with you from the room.
Yeah, we don't want you to leave
Thank
the
you.
phone in here.
Hey, roll call, please.
Doobie,
Yeah.
Silva,
Silva, yes.
Tarver, Young,
Young, yes.
Sanchez,
Sanchez, yes.
and Stratford.
All right, everybody online that's joining us in the closed session, please accept your invite. As a reminder to those in the room that have also joined digitally, you must also join the closed session digitally.
That's what I mean.
But I did minutes, my committee. Sorry.
I'm still missing one online person and, oh, I guess two online people.
He's getting. He's doing it. Thank you.
Online folks, please accept your invites. We can't start the closed session until you have joined the digital closed session room.
Who else we got? Williams that needs to join?
Mr. Williams and Mr. Tepe.
Mrs. Tepe is taking care of it.
He doesn't have a touch.
But his mouse isn't working either.
Use the key, the touchpad.
Okay, wait, let me try the little guy here.
Mr. Williams, are you there? Please accept your invite.
Calling Mr. Williams.
Doesn't want to. can give it, yeah, I'm sure you can give it with just so that. No, I have to hop on a grant writing thing. So. I'll drive out to the barn and listen to my webinar. On my phone when I'm driving to the barn. I multitask.
No.
We are now in open session.
Yes.
Madam Chair,
Parts of my
Now-
brain that worked at the same time.
Now we are in open session. Thank you.
You'd have a light, a little green light or something.
Yeah.
Like that.
We need a laser. Okay, clerk, please call the roll.
Yes.
Doobie,
Should be here.
Silva,
Silva is here.
Tarver,
He's gone.
I'm sorry. Young,
Young here.
Sanchez,
Sanchez present.
Stratman.
Strathman here. Okay, I'd like to have a vote on the release of the closed session minutes as presented by Mr. Cermak this morning. Can I have a motion?
Sanchez moves to release closed session minutes as presented in Exhibit A. It's typically how we do it. Yeah.
Okay.
Second.
Young will second. Thank you. Please call the roll.
Doobie,
Should be I.
Silva,
Silva, yes.
Young,
Young, yes.
Sanchez,
Sanchez, yes.
Stratman.
Strathman, yes. Okay, I forgot. I jumped the gun here. I didn't ask for a motion in a second to replace the reports on file.
Sanchez asked for unanimous consent to place the reports on file.
Okay, been asked for unanimous consent.
Aye.
Okay, any new business? Okay, I see no public comment. I would just like to close with one thing today, and normally I start out the meeting with saying what historic event happened on this day. Well, I'd like to say that 24 years ago today, I became a grandmother. So that's the historical event for today. So
There's another one.
Our birthday, right?
I did have a public comment. I did
Yes.
sign up for public comment.
oh, well, what would you like to say?
Okay.
Yes. You have to go up to the podium
You got to take your county board hat off first.
and your name tag and all that stuff.
Yeah. Turn in your ID, your badge.
Special consideration
Your
here.
wallet?
You know what? It's right here. Speaker sign.
There you go.
Well, we used that already. Oh, I
Oh.
beg your pardon. I beg your pardon. So, yes, Mr. Young.
Hey. Are we ready?
Ready.
All right, David Young. I wanted to bring up everybody's attention an article that came across my reading from the Western Journal last week, January 10th, 2024. And it's called the Western Journal. And last week, Dr. Anthony Fauci was interviewed by the House Select Subcommittee on the Coronavirus Pandemic. And it states that a news release posted on the website of the House Oversight Committee revealed that Fauci claimed that the 6 feet apart social distancing recommendation promoted by federal health officials was likely not based on any data. He characterized the development of the guidance by stating that sort of just appeared. So I want to repeat that. Fauci claimed that the 6 feet apart social distancing recommendation promoted by federal health officials was likely not based on any data. He characterized the development of the guidance by stating it sort of just appeared. And this was last week. Now, Kane County Health Department followed the advice of social distancing, and I did a quick Google search and I found a document, and it clearly shows that they were promoting the social distancing, as was everybody else throughout the whole entire country, probably. But the reason why I bring this up is that, we need to hear about this truth, even if it's 4 years later, so that we don't repeat these same mistakes. Social distancing, it appears, was not based upon really any scientific data, just made up. So my ask, and he's not here, but my ask for the for the Kane County Health Department is to research this. And if this truly is the case, we should eliminate that from any website or any literature that that promotes this social distancing. And then it makes you think, what else was Dr. Fauci, what else is he lying about? You know, he was the face of the country during this pandemic, and a lot of the policies that he that he wanted went through the federal process all the way down to the state process. So there's a book out there. I've mentioned it in the past. It's called The Real Anthony Fauci, written by RFK Jr. And it talks a lot about what I just mentioned, but a lot more about Anthony Fauci. So I encourage you guys to get that book and take a look at it. Thank you.
Okay, that completes our very long and very informative meeting this morning. Thank you to everybody for contributing. It was a great meeting. And I'd like to have a motion and a second to adjourn.
Sanchez moves.
And Ms. Juby, let's keep it consistent.
Sure, second.
Okay, thank you.
Yeah.
All in favor?
Aye.
Hi.